Hi, how are you? My name is Tony Maritato. I'm a physical therapist at Total Therapy Solution. In the next couple minutes, I want to share a couple strategies and information that you can use to get the most coverage from your insurance coverage related to your physical therapy care after a total knee replacement. So let's talk about language for a minute and a couple of the words you've probably heard but maybe don't totally understand. Your deductible is the amount of money you will have to pay out of your pocket before your insurance starts to pay any kind of reimbursement toward any medical care. A deductible might be as low as $1,000 or $500 or as high as $5,000 or $6,000. The deductible is what is paid by you, the client, the beneficiary, after your insurance adjusts the price. And so what I mean by that is, if a typical medical visit you might see a bill for $300. Your insurance company has negotiated a rate with that provider to reduce that $300 down to $150, for example. And so you're gonna pay that first $150, which will be credited toward your deductible until your deductible is met. Two other terms that I think are really important are coinsurance and copay. And so a copay typically is a fixed dollar amount. For physical therapy, for example, it's not uncommon that a patient might have a $30 or $40 or $50 copay. That means every time they go to a physical therapy treatment, regardless of the duration, 15 minutes or 150 minutes, they're gonna pay the copay amount. And that's really important because we're gonna talk about that. Coinsurance is a percentage of the allowed amount. So where one patient might have a copay of $30, and if they go to physical therapy 2 times in a week, they're gonna pay $30 each time, so it'll cost them $60, regardless of what the physical therapist charges or what the insurance allows. The coinsurance, let's say somebody has a coinsurance of 20%. When the insurance company adjusts the cost, so say there's a $150 charge and it gets adjusted down to $90. If you have a 20% coinsurance, that means that you're gonna pay $18 per physical therapy treatment. Now let's get into the important stuff, the nitty-gritty, the juicy stuff. So if you have a flat dollar copay, you're gonna pay, for example, $30 or $40 or $50 every time you go to physical therapy, regardless of the time spent with the therapist. You wanna pick a facility that may allow you to attend physical therapy fewer sessions, but for longer duration. They might spend an hour and a half or even 2 hours with you once a week or once every other week. They spend that time teaching you what to do on your own, showing you home exercises, providing you resources like videos and pictures and education so that you can really do the stuff that you're able to do on your own, so you're not paying for the care that you don't really need to pay for. That would be the ideal scenario if you have a copay, because you're gonna pay the same dollar amount no matter how long you're there, if you're there 15 minutes or an hour and 15 minutes. So you'd be better financially to have fewer sessions, longer in duration for each session, and do more of the work on your own. Now, if you have a plan that has coinsurance, so you're paying a percentage of the allowed amount, you may prefer to have more frequent sessions at a shorter duration. Physical therapy is typically billed in 15-minute time increments. So for example, if you had a rotator cuff repair or you've had a knee replacement and your physician has ordered physical therapy and you feel and that you need the manual treatment of that therapist, but maybe you can't afford a 4-unit, 60-minute treatment, you have the right to ask that physical therapist to provide you with a single unit, 15 minutes of manual therapy to help improve your range of motion and do the things that perhaps you can't do on your own. And that will be the total charge for that visit. You could do the rest of the exercises on your own as long as you're adequately trained and comfortable and understand what you're supposed to do, but you shouldn't have to pay if you can't afford or choose not to, for the stuff you can do on your own. A very typical scenario would be a patient comes into an outpatient orthopedic physical therapy treatment. They might warm up on a bike. That's all billable time that, for example, you could walk around outside in the neighborhood for 15 minutes to get your warm up, do your stretches on your own before the treatment session, then walk into the treatment session ready for your physical therapist to provide the hands-on. And what that would do financially is turn what's normally a 4-unit visit, 60 minutes, and you're paying a co-insurance, 20% on all of that charge, into a 15-minute manual therapy session, which could bring your co-insurance down as low as $5 or $7. So if you don't understand the coverage that you've already paid for, it's really hard for you to make smart financial decisions, which as a result could interfere with the progress and the ability of you to recover fully, your therapist to provide the care that you need. And nobody, you nor your therapist, wants you to end up with a huge financial burden that you weren't ready for. So if you have more questions about insurance, about what your coverage is, you should know what your coverage is and you should know your exact cost before you ever attend a single physical therapy session. And if the provider can't give you that information, because many of them truthfully don't have the systems in place to help you, let us know. We have insurance providers and experts who are well trained in checking benefits and developing plans for their clients so that you can maximize the coverage you've already paid for. You've paid years of healthcare premiums. Now it's time you're actually going to use the service you've paid for. You want to get the most bang for your buck. So if you still have questions, this was just a primer to give you an idea of some different scenarios. Feel free to contact me. Leave a message in the comments below or private message me. We can always check your benefits and provide you with a detailed plan so that when you start reaching out to physical therapy providers, whether it's a hospital network, a private practice, you have the tools so you could say, look, this is my coverage, this is what it's going to cost me, this is what I'm able to pay. Let's create a plan together that gets me to my goals. Thanks for watching. I'll talk to you all soon.